Thank you, Dr. Amin Azzam, for talking to us about the medical student Wikipedia elective. I'm curious what inspired you to lead this.
Well, like many good ideas, the idea originally came from one of my former med students. Over a coffee, he was explaining how so many med students go to Wikipedia first to get information. And so he suggested the idea of contributing or editing or improving the content. And I was at first very skeptical. And as I learned more, I came to realize that there was a lot of wisdom in his idea.
So that's intriguing that you say that they go there for their information too. And I found that too. I found found that students in preparing for an operation will often stop at Wikipedia first. And so can you characterize what these students have been finding in terms of the accuracy and comprehensiveness and
Sure. I think the first thing to say is that our elective is part of a larger effort at Wikipedia, which is called the Wiki Project Medicine community. Like much of Wikipedia, it's based on volunteers, and so there are a number of physician volunteers and other health professional volunteers who are part of the Wiki Project Medicine effort. And we are piggybacking on that existing effort. So Wiki Project Medicine has taken Wikipedia health-related articles and rank ordered them by importance. And they've ranked them both by the number of unique eyeballs and or a number of unique clicks of the different articles. And so once they rank ordered them, they decided they would prioritize improving the quality of the top 100 articles. So when you look at the Wiki Project Medicine top 100, there actually is a quality scale that the Wiki Project Medicine community uses. Articles start at what's called a stub of an article. They move to a start, then to a C quality, B quality. We skip the letter A and go up to good articles, and the highest quality articles are featured articles. So amongst the top 100, there are still several articles that are still in the low quality, sort of a C quality, B quality range.
mm-hmm.
And so I encouraged our students in our first pass on the elective to prioritize those top importance, low quality articles and to improve them or to try to move them up the quality scale.
Interesting. So in the students, it's an elective. It's not. What proportion of the students are choosing to do the elective?
Sure, thanks for asking. So we've only run it once, and we ran it for fourth-year medical students exclusively, figuring that fourth-year students had a sufficient body of knowledge under their belts and also that they would still be able to communicate in common ways that would be easy to understand and interpret. We chose to use fourth-year students in the months of November and December because they were off on the residency interview trail, and this was a very travel-friendly elective that they could be doing. So in this first pilot run, we had 5 students sign up for the elective. That's actually a pretty big number for a fourth-year elective, so I was pleased with that. We wanted to make sure that proof of concept that it worked. So we had 5 students this first go around, and the 5 articles they chose to work on were hepatitis, alcohol withdrawal syndrome, white blood cells, cirrhosis, and the 5th one was not part of the top 100, but a topic a student was very interested in on race and health.
Interesting. And the students, besides varying quality of those articles, have they found anything just outright strange or just wildly off base?
Well, I think what's interesting about Wikipedia is that, because so much of it has been contributed to by the broad public and not specifically narrowly by medical health professionals, one of the things the students discovered as they began to edit and improve the articles was thinking about the order of things in the articles, and not only the order, but let's just be very specific. Let's talk about a list of symptoms with a disease. They found themselves thinking, should this be an exhausted list of all the possible symptoms, or should this be a list of only the most frequent or more common ones? If we're going to think about the symptom list, should we put it by most frequent first, or should we put it by most serious first, or should it be by alphabetical order? So those kinds of editing things were things that they didn't realize that they would want to be thinking about as they edited. Then, of course, there's also issues around the relative balance of the content. So if we're talking about alcohol withdrawal syndrome and we want to think about the biologic elements or the psychological elements of alcohol withdrawal, how much text space should there be dedicated to each of those domains? Those were some of the things they had to think about. One thing that came up that was surprising to them and me, I think was really interesting, was that fourth-year med students are used to buffing and polishing their work before they share it with their attendings and supervising docs. And so this was true as well. So if you look at the course of the month, most of the students were actively engaged in thinking about the articles they were editing, but they didn't actually hit send or make those edits live on Wikipedia until later in the month. I don't doubt they were working on the articles, but they were doing it in their talk pages or their sandboxes or in their privacy of their own computers before they actually went live. Now that's a different way. I mean, that's expected of all med students. I understood that. I didn't realize that it was going to take more effort to get them to embrace the open culture of Wikipedia, to be actually editing boldly and actively throughout the whole month and allowing others to see their work in progress and contribute and improve on it.
So that's different editing behavior than the average Wikipedia contributor then?
I don't know per se. I mean, I would imagine lots of, there may be other content domains where Wikipedia editors also play in the sandbox before they go live. But there is a culture in Wikipedia of edit early, edit often, be bold, to allow the larger community to be contributing to the dialogue. And that is perhaps probably a minority strategy for editing.
And this may be sort of a self-selected group, the people who chose to become Wikipedia editors, but are they, do you think you made some habitual long-term contributors from the...
It's a wonderful question, and it's sort of time will tell, per se. At the end of the month, I asked them all that question, and all 5 of them said they definitely wanted to be actively contributing because they saw the potential impact that their work was having on the planet, really. However, at this point, now we're only a couple of months out, not all 5 of them have continued to edit. In fact, there's been 1 or maybe 2 of them so far that have. Now, I want to give them a little bit of permission to sort of have a little time to pick it up because they're finishing their residency interview trails, and so I can understand that's a more important, time-sensitive thing. So we'll see if more of them contribute going forward.
Mm-hmm. And I'm curious about the resources they're using to make their edits or make their contributions. Are they often using closed access resources like provided by the university?
Absolutely. I think that's what makes this a successful model, was that in addition to working with the students at the beginning of the rotation to establish the step to what articles they were going to work on and get a sense from them of how they were going to do it, we had them partner with the librarians, the medical librarians, to understand what are the different, as you said, closed access resources that we have available at the university for them to be seeking out the high quality, reliable medical information. And so students worked and partnered with the librarians to get a sense of that. One thing that came up as they edited was some of what the librarians refer to as foreground or background literature. So foreground is a cutting-edge research that's sort of novel issues that are coming up as we push the boundaries of science. Background might be things that are in printed texts that haven't changed for a number of years. The symptoms of appendicitis, for example, are the symptoms of appendicitis. That hasn't changed per se, so there's nothing new that's coming out with that. So students realize that they sometimes would need to go to these established medical texts because that was the source of reliable references, and they didn't need to go to the foreground literature. But they were certainly using a combination of the background and foreground literature in identifying articles and sources to reference in the sentences they contributed or edited or added.
Sounds like a really interesting project. Is there anything else you'd like to tell the world about the project?
Yeah, absolutely. So one of the things that I think is fantastic about this effort is that Wiki Project Medicine is also partnering with Translators Without Borders to take these top 100 articles and translate them to the world's most populous languages, and back translate them to English to make sure that they was accurate. They're also partnering with a text simplification company to make sure that this is written in ways that the general Wikipedia reading community can understand. And lastly, they're partnering with Wikipedia's effort called Wikipedia Zero, which is to make these articles available on cell phones in the developing country without charging data plans. So effectively, what this small piece does is put together high-quality medical information available to the world's population in the way they access the internet now, which is cell phones, but free of charge in the language of their preference. So when you put all that together, I just think this is a wonderful opportunity to do good in the world and make a big difference in the public.
Yeah, it sounds like a really beneficial open access project. Thanks so much for talking to us about it today.
Totally my pleasure. Thanks for your interest.
Take care. Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook, follow us on Twitter, and find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.